with announcements. Welcome everybody to Iowa Lakeside Lab. Many familiar faces here. Just a couple of announcements and reminders about events that we've got going on. So tomorrow we have our Wild Wednesdays, and Wild Wednesdays are family fun. Tomorrow we have Olivia, I believe, who's working on amphibians, so we'll have an amphibian presentation. I have no confirmation of this, but there may be frogs involved. So come check out our Wild Wednesday. On Thursday, we have a poetry, or Wednesday, we also have poetry. So Wednesday we have poetry. We have an artist in residence who do not currently see him in the room, but he is a University of Iowa student, and he will be sharing his poetry. And that will be in Waite, so the Waite building. Tomorrow, you can either do family fun or poetry. And then on Thursday, our artist in residence, Austin Stewart, will be doing an open studio in Bodie. So you have lots of opportunities. Oh, here comes our writer, Bodie. So tomorrow he'll be doing his poetry in Waite. So lots of good things still happening. The other thing I will ask people to put on their radar is August 11th, 12th, and 13th is the Prairie Lakes Conference. So on August 11th in the morning, we will have a field tour of the Francis Sites wetland that's been put in place to help protect the lake. That afternoon, we'll have some technical sessions talking about water quality in the lakes area. That'll be at Majestic Pavilion. Then on Friday morning, we will have another kind of walking tour of Arnold's Park area, some of the conservation practices that have been helping with water conservation down in Arnold's Park. Then we'll have lunch, and then we'll have a tour on the Queen around the lake to talk about the history of the area. John Wills will be talking about water quality projects as well. Rebecca Peters will do a fun kind of history presentation. And then on Saturday, under the big top, we'll have Dr. Jim Pease. He's an Iowa State Professor Emeritus who has done a lot with conservation. Just got back from Africa where he led a long tour of conservation-minded individuals. But he'll be under the big tent at 8:30 on Saturday the 13th. So lots of good things happening that second week of August. It's sort of a la carte, so you can register for any or all of those events, and kind of some are free and some are pay as you go. So please check out those events. All right, I'm going to go ahead and introduce our panel. We're really excited to have this discussion today about mental health, which is a top priority for Dickinson County. And I think shout out goes to Leah, who kind of pulled this together in terms of talking about bringing folks together to have a conversation. So we'll make this definitely a conversation. I'm going to just introduce our panelists in no particular order, and then I'm going to turn it over to Leah to kind of run the event. So first we have Katie Burke, who is with the Dickinson County Public Health Agency. And they've been looking at mental health and public health care gaps in Dickinson County, trying to understand how we can fill those gaps. Beth Will is with the Sioux Rivers Mental Health Providers. They provide access, information, and coordination of funding while providing for the health, hope, and successful outcomes of the residents in our region who have mental health and intellectual development disabilities, including those with multi-occurring substance abuse issues, health issues and physical disabilities, brain issues, and other complex human service needs. Autumn Hartman is with the Rosecrans-Jackson healthcare provider in the region with multiple locations who serve adolescents and adults with individualized addiction treatment and prepares them to go into a life of recovery. We have Sarah Birdie Griner, who is with the Plains Area Mental Health, Regional Mental Health Services Provider. They provide doctors, therapists, support staff, and other experts and healthcare professionals to serve the needs of people across the ages. And then last but not least is Danette Tullen. She's with Hope Haven, a disability services and advocacy center that provides a broad range of services from kids to adults facing a variety of challenges. So we have a very illustrious panel here tonight, so please join me in welcoming them. I'm going to turn it over to Leah to lead our conversation.
Thank you all for being here. So thank you, Mary, for that introduction and for all of your explanation of the services that you provide. One of the first things that we're going to have from our panelists are what actually brought them individually into caring about mental health before we talk about some of their regional concerns and expertise. So what I'm going to ask each of you panelists, I prepped you, so you better have a good answer.
That was it.
I would love for you to share with the audience either a moment or an experience or something that shaped your passion and enthusiasm for mental health as an industry, and then also in particular your care for the greater region and local communities. And we'll start with Katie, since you're right here on the side.
All right.
And if you wouldn't mind speaking loudly, I just got in trouble. And if you would also say your name out loud again.
Absolutely. My name is Katie Burke. I'm with Dickinson County Public Health, and I would say one of the experiences that comes to mind when I think about mental health is I was in a large room with maybe 200 people, and they were asked a question, do you know anyone or have you personally experienced mental health issues? Almost everyone raised their hand in that room. And it was a silent moment that I think you just realize that you can't see it, but it's impacting everybody. So, but in my role going into community health needs assessment, I think we've heard a lot we had over 600 people participate in our survey in September, hearing about what really are the concerns of Dickinson County residents. And above everything, we saw behavioral health. So, I mean, this impacts every community, including ours, and so one of the things we heard so much about was a lack of an awareness of what's here. And so we really appreciate Leah and Mary and Lakeside Lab facilitating this conversation to begin to share more of these resources with providers like the ones to my left.
Amazing, thank you, Katie. All right, Autumn.
So I'm Autumn Hartman. I work with Rosecrans Jackson Centers. Prior to working at Rosecrans, I was actually a youth pastor, and I saw a lot of my youth who had behavioral and mental health struggles, and none of us leaders knew how to really work with them. And at the same time, personally, I always like to share a little bit of my journey. I was diagnosed with depression, and so I was like, there's got to be something that we can do more of, and that's how I became really passionate about what we do. As for Dickinson County, kind of like what you said with the needs assessment, we've done some of that with Rosecrans too, and that has definitely been something that has come up as mental health concerns for Dickinson County and the areas.
Thanks, Autumn. Sarah, go for it.
Yep, my name is Sarah Brady Greinert, and I am an intake specialist at Plains area. I think what these two women have just identified, myself as well, personally going through some mental health struggles in adolescence, but not really knowing exactly what to do with that, who to talk to about it. That led to my desire to go into this profession. I studied at the University of Iowa, and I always wanted to come back to rural Iowa because I knew that the need is even greater, and the lack of access is present, and the lack of awareness, the stigma, and I think it's wonderful that we're having this discussion tonight to kind of decrease that and broaden our understanding of mental health and what's out there.
Amazing, thank you. Beth, your turn.
Hi, I'm Beth Will. I am a service coordinator for the Sioux Rivers Mental Health region, which we'll get into. And I'm based out of Dickinson County, and I also service Emmett County. What my role is there is kind of the connector. I'm the connector of the services and the referrals to a lot of these agencies. I started with the county 30-some years ago. It seems like yesterday, right? But mental health was new as a delivery system, and I'll speak of that later. But it was a chance for me to build a program of mental health services, and how it changes every day is still fascinating to me because there's never two cases that are the same. It's always changing. It's kind of like a puzzle and connecting individuals to services and helping people through issues and seeing success stories. And that's probably what keeps you going as far as the successes that individuals have.
Thank you, Beth. Sorry, I combined your name together and
That's
called you
right.
Bill, so thank you, Beth.
It happens a lot.
And then last, Danette.
I'm Danette Tolan. I'm the Community Living Hab Manager for our east side of our services for Hope Haven. I have been with Hope Haven for 15 and a half years. I started in 1992 when I was in high school working with individuals with intellectual and physical disabilities, and I completely changed my mind when I went to college on what I wanted to do at that point. So I got my degree in social work and just continued to work for an agency while I was in college, and now Hope Haven. So when I started at Hope Haven, I was working with the individuals with intellectual disabilities, and as Hope Haven's mental health started growing, then I got into that side of it. So that's how I got interested in the mental health part of it.
Wonderful. Thanks you all for sharing a little bit about yourselves. I'm going to be a little unorthodox, and I'm going to actually ask the audience in a very easy way to share a little bit about yourselves. And much like Katie mentioned, we don't always realize who in a room is familiar with mental health. And I would appreciate if everybody who is touched by mental health, whether it's your own life or someone close to you, would raise your hand if this is something that you think about somewhat regularly. Amazing. Thank you for sharing. So you now know a little bit more about your audience, which is probably what you expected. Other things to know about your audience is that we have students and interns, we have full-time residents, we have summer residents, and we also have a lot of transitional residents who are here. So as they listen, they're bringing questions not necessarily from Okoboji, but they also bring at least a summer's worth of getting to know the wonderful people around here. So as they have this experience behind them, I'd love for each of you to take the time to talk a little bit about what it is, the work that you do. For you, audience, first I'm going to have Katie Burke talk more about that mental health assessment that she mentioned at the beginning of her discussion. Then I'll have Beth do a little bit of a broader regional area. And then each of these three providers, who are experts in various types of care when it comes to mental health, will talk about the services they provide and the issues and solutions that they get to encounter on a regular basis. At the end of that time, we'll have a Q&A period. So come up with good questions. Katie, go ahead.
Yes, so as we were talking about in the beginning, so we currently conducted the fiscal year 22 Community Health Needs Assessment, sometimes referred to as the China. So we do this as part of the hospital every 3 years. Public health is required to do it every 5, but since we're hospital embedded, we do it every 3 years. So we had the survey in September, and so we were really glad to see double the participation we saw in the previous cycle. So we had upwards of 340 the last time. I think we had 615 this last time. So looking at that, behavioral health stood out. We also had affordable transportation and dental access for the Medicaid population. So all three very easy problems to solve. So we, kidding. But that's okay that these are major issues, because that means that we get to address them and begin to move the needle. So what we did when we started to see these comments arise and saw behavioral health was something we need to focus on, each of our three prioritized significant needs became a focus group. So we invited stakeholders such as this of different providers in the area coming in to see different perspectives on how we can approach behavioral health. And so what we heard about, we broke it down. This is what it looks like. It's available online at lakeshealth.org. But it goes into a lot of different things, but we broke down the focus groups to say what are the biggest obstacles, the ideal world solutions, and the action items. And so what we saw, the biggest obstacles are, of course, shortage of providers, awareness of resources and services, substance abuse support, COVID exacerbating the issues that were already there, and just that some of that turnover. So we saw that, and then we opened up the conversation to talk about ideal world solutions. So hearing from these providers, it'd be great if we had unlimited resources, eliminate all financial barriers, and engage populations. So then we broke it down to what are actual action items that we could look at. So one of the first things that we saw was beginning a behavioral health coalition. So we have the Dickinson County Behavioral Health Coalition now. We were hoping to part it as part of an existing coalition, but now we have one more coalition in Dickinson County. This is meeting on a quarterly basis, and so we're starting to look at what can we do as a group. So part of that will be having events like this, increasing awareness, having family fun days, looking at reducing stigma, and also having more of those liaisons and connecting with other groups, especially in schools. So we are now in the health improvement plan. So we created the report. So that was a mix of primary data from the survey and secondary data from research. And now we're in the health improvement plan to create measurable, feasible, hopefully attainable goals for the next 3 years.
Wonderful. Thank you so much, Katie. Now, I gave each of you 5 minutes. So I want to follow up with what you just said with a question. This makes it a discussion. So as you're looking forward to implementing some of these measurable goals, how does the area, especially around Lake Okoboji, being somewhat transitional, affect the schedule and your ability to put these coalitions together?
I think there's certainly a core group, but I think that can change throughout the year. The needs change. I'm sure these ladies could speak more to that about what summer looks like in support versus what winter looks like in support, but we welcome people into the conversation. So if you're interested in this, you can certainly reach out to dcph@lakeshealth.org, and we can give that to Leah as well if you're interested in that. And we're just beginning, so we've only had our 3rd meeting, so we're open to seeing how this can evolve and become something that connects with everyone, because we're building the plane as we're flying it a little bit, and I think that's okay. So.
Wonderful. Thanks, Katie. Beth, go for it.
All right, I'm gonna stand up. I dropped it in my hands. And I don't feel as bad as I sound. So, with that, like I said again, I'm Beth Will with the Sioux Rivers Mental Health Region. And my piece tonight is to kind of educate you on the mental health system itself and a little bit of the history. So I don't have a lot of fun stuff, but here's the good part. The service providers have brought information, swag, glasses, notepads, pens. Please help yourself to them and take them all so we don't have to take them home. So with that, I'm going to talk a little bit about the mental health system and how it's evolved over the years. And I'm not going to go back to the beginning of time, but I am going to go back to 1996. In 1996, the Iowa legislature set a levy and said, counties, you go ahead and run a mental health system for your residents of your county. So in 1996, there was 99 different mental health systems in the state of Iowa. Each county had their own rules, each county kind of did their own thing, had their own map and guidance and what they would pay for and so forth. Prior to 96, it was a state-run system. And so you'll hear me talk, reflect back to that. So in 1996, we started 99 different mental health regions. In 2012, they thought, that isn't working so good. We're not level across the state of Iowa. We got some counties over here providing these services, counties over here providing different services, and that wasn't fair, that wasn't equal. So that legislative session in 2012 said, we're going to go ahead and form mental health regions with the goals to improve that equal access, easy access to services and supports to our Iowans. Well, that was good. So then we had counties in cahoots and talking, and what county wanted to play with what form regions, and it took 2 years before we came up with the actual mental health regions. So in 2014, the regions were formed, and out of the 99 counties in Iowa, there was 14 regions established. Again, now we're charged with the goal of providing equal access. Today, Dickinson County is part of the Sioux Rivers Mental Health Region, and that encompasses, for those of you that have geography of Iowa, Plymouth County, Sioux County, Lyon County, O'Brien County, Dickinson County, and Emmett County. So we are encompassed of 6 counties to formulate the Sioux Rivers region. And for those of you who want the whole history of the Sioux Rivers, there's a brochure over there, and I'm not going to go into all of that, but it's light reading for you at the middle of the night. The regions are governed by a management plan, which is approved again by the state of Iowa. The state of Iowa has given regions the authority to have certain services available to all the individuals. In 2017, they came up with the idea of we needed complex services. And this is really kind of the meat and potatoes of our region and the services that we provide. And complex needs, that's kind of a broad, crazy term. What that really encompasses is crisis services. And at that point, it was adult crisis services that they wanted us to really focus in. So mobile crisis, where individuals, agencies go out to the individuals in the communities and assist them with the crisis that may be at hand. 23-hour observation was another charge that we had, which means it's a location for an individual to go. Maybe they don't need that higher level of a hospital, but they need care and supports, such as medical or nursing or whatever. But it's a place to go. It's kind of like adult time out. You can kind of take a breather from the situation that you're in and obtain services. Such other things that included in there: crisis stabilization, access centers, and then our crisis lines. And you'll hear in the media crisis lines, call this, talk lines, so forth. The thing that I want to kind of give a commercial out to is 988. 988 started on Saturday, which is a federally funded crisis line serving the United States. It's a live person when you call that number, and trust me, I've had a lot of people do it. I just want to see what it did, you know. So it works, but it is a federally funded program, and it is a new service. So it's kind of like 911, but we have 988 it's a warm line, and they are making referrals back to our local agencies for services for our folks that are in need. In 2019, legislative, they said, you know, you're doing such a good job on those adult services. I don't know if they did or not, but it sounds good. Let's do children's services. Let's mirror that adult system for children. Now, that was really kind of nice, but they kind of forgot to give us more money. And so, you know, do more with less kind of concept. But again, now our regions are put forth to mirror the adult service system for the children or the adolescents under the age of 18. This past year, there was a Senate file passed too, which shifted our funding. So instead of being property tax dollar driven, as we were from 96 until July 1st, we're now state funded. So those of you that are paying your property taxes, you saw that little line on the bottom that said mental health services. Well, guess what? We get to erase that. So you will not pay local property taxes on the county level. But trust me, you're gonna pay it somewhere on the state, I just know it. It's just gonna get a little shift and look a little different, but it's there. So that kind of gives you this, the history of the funding and how the services evolved. Now the mental health region, or Sioux Rivers, we are kind of I don't want to say a broker, but we kind of are. We are a service connector. The mental health region does not provide services directly, per se. I don't provide therapy in the office, and I don't go out and take individuals grocery shopping and so forth. But we contract those services with these service providers here, which you're going to hear from tonight, to explain more of the service delivery system. I want to do another little shout out to a couple things. Bill Leopold sits on our governance board for our mental health region, and then we also have another service provider in the room with Lakeside Skills, who is another service provider in our county. So they can also field questions if we need to. So that's what we got.
Amazing, thank you guys.
Thanks.
Thank you so much for that overview, Beth. I do have a question for you. Are we using maps of Iowa from 1996 or 2019 for our geography and our years?
Did I say something backwards?
No, I just can't imagine knowing my state as well as you can.
It comes with it. 1996 kind of looks like it does today, so it doesn't matter.
So thank you both for that overview. I want to let the floor go to our service providers. And for our service providers, I'm actually going to have Danette from Hope Haven go first, because we actually just got to have clients from Hope Haven here at Lakeside earlier this week on a kayaking trip and hanging out in the dining hall with our interns and students. And we really enjoyed getting to meet the staff and the clients that week. So I'd love to hear some context of our good company this week and what it looks like to serve the population of clients that you have.
Okay. So I'm going to start out Hope Haven. Our mission is, as followers of Christ, we unleash potential in people through work and life skills so that they may enjoy a productive life in their community. Our vision, Hope Haven, is community committed to the special creation of God that is human being, encouraging the realization of dreams, desires, and aspirations, valuing gifts, talents, and contributions, sharing accountability for individual and community growth. Hope Haven started over 50 years ago. Actually, I think it's over 55 now. We opened our doors as a school for children with disabilities in Rock Valley, and now we currently serve adults and children in over 15 communities in the Midwest, and we have delivered over 130,000 wheelchairs to those needed around the globe. We have several different services that we provide throughout Iowa and Minnesota. Our residential services include our Children's Immediate Care Facility, our ICFID, through Faith, Hope, and Charity in Storm Lake. We serve children 3 years to 18 years of age down there, and that is licensed through Iowa DIA. We have our RBSCL, which is our residential-based supported community living services, and we have 5 homes between Rock Valley and Orange City, and that serves girls and boys between the ages of 8 through 21. They go to school in the local schools in their towns. And all of those homes are staffed 2 to 4 ratio. Our adult group home, we have 1 of those in Rock Valley. It's our residential care facility for our ID folks. And that has up to 12 beds. And what I'm most familiar with is our waiver homes and our home-based habilitation homes. We have over 60 homes right now throughout Plymouth, Sioux, Lyon, Osceola, Clay, Dickinson, Emmett counties. All of our homes serve anywhere between 4 to 5 individuals. It's a home just like yours or mine. You would never know driving by if it's a waiver home or a habilitation home. The staffing is built around what the individuals need, and the persons living in the home are the ones that decide how the home is going to be run. The staff are just there to support them with transportation, attending doctor's appointments, going to church, and budgeting, grocery shopping, all those kind of things. We also do those same type of services with individuals who live in their own apartments, or if they live at home with their own families with adults and children. And we do those services throughout all of the same counties in Northwest Iowa. We do respite services also with children in all of our counties, and that is basically just a service that we provide that is a break for the caregiver, the primary caregiver. The stipulations with that is the primary caregiver cannot be working. It's for them if they need time out of the home, if they need to go grocery shopping, run errands, those kind of things. We provide those respite services for them. We do have some supported living services in 2 counties in Minnesota, and then we do have some employment services also in Minnesota in Worthington. Our employment services are quite expansive throughout all of our counties. We do our My Choice employment, which we help individuals get jobs and continue to have their jobs in communities. They're integrated. We have a lot of clients that work at factories in the area, restaurants, gas stations, different stores, hospitals, all those kind of things. IPS services is our individualized placement supported services for employment, and that is mostly directed with individuals with mental health to get a job, and it's a very short-term placement. It just helps them get the job and establish the job, and then they can move into the My Choice if they need more support throughout the time. We do have our Double H manufacturing, our manufacturing in Rock Valley, and that is a completely integrated factory that we have individuals that work at along with other community members. And our big thing in Dickinson County, we have our day habilitation services, and that's our My Day services, and that is for our individuals to participate in their community. They volunteer, they deliver Meals on Wheels, they come out here and kayak, and they go to the library, they participate in their community just like you or I would. And then mental health and recovery services, we have our Keys to Success program, which we have several locations, Spencer, Lamar's, Primgar, Sheldon, that has groups that focus on intensive psychiatric rehabilitation. And then we have peer support services, and then our HAB services that I manage. And then we have our spiritual support services, which we have 2 pastors that are employed by Hope Haven, and they assist our clients with their spiritual needs. If we have a new client that moves into a community, they may help them find a local church that they want to become involved in. They help them with grief support, any kind of spiritual support that they need. And then they also work with the staff if the staff would need spiritual support in any areas. And then we have our Hope Haven International, where we deliver our wheelchairs across the country, Vietnam, Romania, Guatemala, all over the world.
Wonderful. Thank you so much. That is a variety of services.
Yes.
A one-man band, except you're here on a panel of 5. So I know you're not doing it alone.
No.
For many of these services, where is the driving brain power for Hope Haven? This idea of the integrated factory combined with a variety of services. Are these models adopted from elsewhere, or is this something that's part of the Hope Haven innovative mission?
I would say it's from the Hope Haven Innovative Mission. We have very long-term directors and board members that have just committed their life to Hope Haven and their visions.
I have another question for you, and also for Beth, for this one. This is a real one, I promise. One thing you both talked about was this idea of political lines, county lines, state lines, and yet also we have local communities, churches we're affiliated, and things like that. when you think about mental health in the region, you may be talking with one state line in mind, but where would you describe is a boundary of community when people are thinking about either who their neighbor is or where they should seek support?
Go ahead.
I think it depends. I mean, we have clients that want to move out of state, and that is a barrier because of services in other states and waiting lists and all that kind of thing.
We have individuals that shop, literally,
Oh, yeah.
for the best service, but it all comes down to the funding mechanism of, the qualifications for whether it's Medicaid or whether it's private insurance and so forth. So unfortunately, the financial aspect of it drives a lot of individuals. We've got individuals that want to move from Nebraska, example, to Shelton because of the brain injury program, example. But getting the funding in place to do that may take years to get the qualifications to be able to fund that for that individual.
Makes sense. Thank you both. Thank you for your explanation of Hope Haven. I'm going to have us go on to Autumn. Don't worry, I'm not leaving you out. You're going to close us out. And the reason, Autumn, I want to have you go next is as you look out on our audience members, we have people who have kids and grandkids, and we have students and interns here. And you mentioned your experience as a youth pastor and the work of Rosecrans with adolescents as well. So I would love to have you go next to talk to us a little bit about the various services that you'll provide.
Yeah, absolutely. Thanks for having me. So what is Rosecrans? We are an organization that deals with substance abuse or substance use disorders as it's more commonly referred to nowadays, as well as behavioral health. We've been in Siouxland for about over 50 years now, since 1976. We used to be Gordon Chemical Dependency, then Jackson Recovery Centers, and then we merged with Rosecrans Health Network in 2019, which is from Illinois, and they also provide substance use and mental health services through Illinois, Wisconsin, and then in Iowa. We do serve 16 counties in Northwest Iowa, which we have up here. Dickinson County is one of them, and then we have Emmett to the east, Palo Alto, Buena Vista, all those fun counties. But we have helped individuals from all across Iowa and even surrounding states like Minnesota and Nebraska. I think we've even helped people from Wisconsin. So we're multifaceted. We really want to focus on providing a continuum of care. So we're doing prevention, which is what I work in, and so does my co-partner Mandy back there. We do education, early intervention, of course treatment, and then we also do have psychiatric and medical care on staff at our sites. We also want to focus on specialized needs for various populations. We serve adolescents, ages 12 through 18, and then obviously adults. We do have a treatment approach that is rooted in our 12-step program, if you're familiar about that. And all of the things that we do are evidence-based, so they are proven to work, not only in treatment, but what we do in prevention. We have several locations throughout Northwest Iowa, the closest being Spencer, which is a half hour south of here, and then the next closest one is in Sheldon, which I'd say about an hour 15-ish from here. And then we also have Lamar's, Denison, and Cherokee. Those are considered outpatient treatment services, so individuals can go in for 12-step meetings and various counseling sessions. Our main offices are out of Sioux City, so that's where we have our residential as well as outpatient. We have a lot of excellent residential programming down south in Sioux City. So we have kind of our main building, which houses our 12 to 18-year-olds and adults. But we also do have something called an ASAW unit, which is Adolescent Stabilization and Assessment Unit. So if an adolescent ages from 11 to 18 is in a crisis at home with mental health or substance use disorders, they can come into our facility, our ASAW unit, and spend anywhere from 5 to 7 days there just to kind of help them get back on their feet, assess what's going on, take care of them, and kind of set them up for success as they go back into the life that they came from. We also do have a women's and children's center, which we're really proud of. We have it allotted for women who are pregnant or have children, And we have a wonderful daycare on site that we've been really proud of. We just got an excellent award that I cannot remember the name of still, but we're really, really proud of it. Our staff there is absolutely wonderful, so mom can go get her treatment during the day and the child is taken care of. So it's absolutely fantastic. We also have recovery apartments. This is kind of to let people get that transition out of residential and then kind of onto their own where they can get a job but maintain that recovery successfully. When we move into kind of what I do in prevention, it's a little bit more trickier. We are funded by SAMHSA and the Iowa Department of Public Health. And we have 2 specific grants that do cover Dickinson County and surrounding areas. Our first one is the Integrated Provider Network Grant. We call it IPN for short because it is a mouthful. And that really focuses on adult heavy drinking, cannabis use in our youth, and then also problem gaming and gambling. So we're doing evidence-based practices in the community, Dickinson County and surrounding areas to help those specific populations and bring awareness too. So we'll do classes on these types of topics. If you're ever kind of like, what is this? I've always wondered, or what constitutes ABCD? We are able to provide those services for you. The grant started in 2019 and is going to be going through 2024, I believe. And then we also have the State Opioid Response Grant. That is the grant that I actually cover in Dickinson County, and we started in 2020 and we're going through 2023. So we're focusing on opioids and the opioid epidemic, methamphetamines. We know that is a big issue here in Northwest Iowa. And then we're also kind of changing the head a little bit of the topic. We're kind of focusing on harm reduction, what that entails, why it's important in public health. And then also things like anti-stigma. We want people to realize that anybody who has a substance use disorder is just like you and I. It's just kind of the way their brain works, and that we should see people as people and not their addictions. And then we also do talk about trauma-informed care and how important that is to understanding the disease of addiction. So that's pretty much what we do in a nutshell. I kind of flew through that really fast, but that's who we are.
Wonderful. Thank you, Autumn.
Thank you.
I do have a question for you, but that means taking questions from them for the Q&A.
Okay,
so I'm going to hold mine.
That's okay.
And let Sarah do her bit on the Plains area.
Yes, thank you. So, as I said earlier, I work at Plains Area Mental Health, and we have this nice pamphlet here that needs to be updated. It says we've been doing mental health services for 47 years, but we actually celebrated 50 years this year. So we are the community mental health agency in this area, and if you don't know, we are located down in the downtown Spirit Lake area, and that building, well, I guess Plains area has been in that building just approximately maybe 3 to 4 years, so it's fairly new. But Plains area really started in Lamar's, Iowa, and since then we've been branching out to different locations, Storm Lake, Cherokee, Ida Grove, Orange City, there's a lot. And so what we do is we accept anyone and everyone. You are able to walk into any of our offices Monday through Friday. You could be a brand new client and you basically ask to do an intake. We call it open access. And so first you meet with a nurse care manager who will do some brief screening assessments with you, talk about kind of daily living activities and how you feel like you're doing on those. We'll do some screeners for depression, alcohol use, drug use, and then after you meet with them, you meet with someone like myself where you can complete a full clinical diagnostic exam, talk more about whether it's a mental health challenge, a substance use challenge. I hear a lot of trauma, family dynamic struggles and difficulties, and then how that impacts their day-to-day functioning. And so after you're finished with someone like myself, then you immediately can get scheduled for a therapy appointment. There's a fly. A therapy appointment if you're interested in therapy, a psychiatric appointment if you are interested in medication management. Pretty much all of our clients automatically get enrolled in our integrated health program. And that connects you with a care coordinator who can get you access to different resources and services, whether it's housing, education, employment. They are basically, another person on your team to help get you access to care. And through the integrated health program, there are peer support specialists who are individuals who have been living in recovery, whether it's a mental health or substance use disorder. And they are great resources too because they have that personal experience. They can relate to clients on a different level than somebody who maybe does not. I think I might pamphlet, so I know I forget things. Our other big thing is our substance use disorder program. We call clinical services where you're treating mental health and substance use co-occurring. We do not silo each one. We don't think that they should be, treating one versus the other first. We want to treat them at the same time because often they are interacting each and every day. And so we have therapists who are trained in substance use, but also have substance abuse counselors who can do individuals as well as group therapy sessions with clients who would meet criteria for a substance use disorder. Through that, we also have what's called the Dcat Grant, which is through Dickinson County, and that is if a family is involved with the Department of Human Services and there is a substance abuse concern, then clients can come to our agency and receive services through that grant, so the billing is basically covered, which is really helpful. Our emergency services, anybody who walks into an office and reports that they are in crisis or in needing to talk to somebody can automatically be seen with anyone, whether they're a new client or an existing client. We will not turn anybody away. We want to meet them where they are. And we also have a crisis stabilization home called Turning Point, which individuals can be there for approximately 3 to 5 days. It's staffed 24/7. They work on coping skills, emotion regulation, but the main thing is it's an area, a safe place for them to go and get help and support and care that they need while they are dealing with the crisis. And the best part about that is we avoid hospitalizations, which can be very cost expensive. And so, what else? The community outreach program is kind of connected to the integrated health. And that's for individuals with severe persisting mental illness. I think I covered it all. Oh no, I do know. My supervisor Darcy, she always wants me to tell it too, that with therapy, we have therapists who are trained in a lot of different treatment modalities. So that would be like what you are doing in therapy with your therapist. For example, many therapists use the kind of evidence-based cognitive behavioral therapy, but there are more modalities such as DBT, which stands for dialectical behavioral therapy. There's PCIT, which is a parent-child interaction therapy. So let's say you have a child who's having some disruptive behaviors or you're struggling with some attachment issues. That is a helpful treatment for that specific area. We have EMDR, which stands for eye movement desensitization reprocessing, which is the most evidence-based treatment for individuals who are experiencing trauma or need to process through those traumas. Yeah, we have therapy groups too, I know, that therapists run each day. So there's a wide range of services, but basically, our big thing is wanting to give people kind of everything that they may need, wrap services around them, and then get them to stabilize out with their mental health and pulling back, piece by piece.
Wonderful. Thank you, Sarah. I'd like to give a round of applause for all of our panelists. So this is our period for Q&A, and maybe this is radical of me, but I'm not going to limit their questions. So if you're not an expert, you're still allowed to answer them. And for any of y'all who are listening, we got to hear a lot of different things about types of services, people affected, and types of needs. where people are focused and what interests us. Many of you all may not realize how this affects you personally, or you might not be a resident of the region going forward, but these are still folks who can talk to you about how to understand the services in your home space or in places where you have loved ones who might be affected by mental health. So I encourage you to ask any questions that you would like to. If you would like to ask a question, just raise your hand. Go for it.
Let's go.
So nationally on these horrible mass killings, there's people with mental problems. I'm not aware of any one of these occurring in Iowa. Am I wrong about that, or have actually been?
There was a names and.
I think so,
There
yeah.
was
Ames
an
is the one that
Ames,
came to
yeah.
mind.
Ames, Iowa had one. I can't remember how many.
Like a school.
I don't know if it was outside in a church parking lot. Or
Yes, that's what it was.
It was 2 women in the middle of the street.
Yeah.
I know the names.
Oh.
Following up on that, is red flag a new science? Is it a new mandate, red flag theory, red flag practice? Is it something that's going to be mandated on you? Is it something you're going to struggle with, like how to do that?
We haven't, I mean, at my agency and you guys obviously, we haven't talked about anything like that. I know about it like for other stuff based on the activities I'm involved in, but I haven't heard anything through the grapevine for my company on how that will affect us.
Similar, I haven't heard of any conversations.
It looks like we have a question from Lynn.
Do any of you deal with homelessness or people that are foster care?
Yes.
Daily.
Would you like to elaborate a little bit on what homelessness care might look like for your services or concerns?
I'll start. Homelessness has many definitions. And depending on what agency or organization you're referencing with that, the definition may change. So because I live with maybe my grandparents and I don't have a house of my own, I may be considered homeless. Even though I really have a roof over my head and, groceries in the refrigerator. But we do have a lot of other homeless individuals. In the office on a daily basis, so whether they're living in a campground, in a tent, or living in their car, we have it here.
I would say weekly we get somebody in our office that is looking for some type of services because they're homeless or they have a mental health, and we refer them to Beth because we can't provide a service unless they have the funding, either a case manager or they're on the HAB waiver or the ID waiver, so they have to talk to Beth first.
I would say in my work in doing clinical evaluations, that gets brought up occasionally. I wouldn't say it's every single time by any means, but often I will communicate with the team lead of the integrated health program for each county that we cover, and just let them know that that's a primary concern and make sure that our care coordinators are reaching out to clients as soon as possible.
I know for our company, I don't really deal a lot with our treatment side, but I do know that we do help clients, regardless of their situation, whether they are homeless, insurance, whatever it may be. So we don't turn anybody away.
So can I follow up on that and just ask whether affordable housing is one of the issues with the homeless, and whether any of you deal with affordable housing with your clients?
Yeah, I don't work one-on-one with, well, I do kind of that initial time, but after that they get connected to all these other people. So I know our care coordinators would be one that would help them, file applications for affordable housing and things of that nature.
Affordable housing is tough in our area, and access, and we do have affordable housing or low-income housing, Section 8 housing available, but unfortunately our waiting lists are quite long. And a lot of times, maybe some of our individuals that we're working with, don't meet that qualification because maybe they're a convicted felon or something in their past is preventing them from accessing that Section 8 housing. So we do have to be a little creative every once in a while with resources and looking for housing.
And it was actually one of the major issues that came up in the community health needs assessment. Originally, we had paired together affordable housing and transportation, but based on who came to the focus groups, we didn't have enough representation from stakeholders to come up with really constructive goals for that group. But I'm sure it will be around for the next cycle. That's something to look at.
Any questions? All right, so we've got a few, and we've got time for all of them, but I'm going to do them in order so we know who goes next. First it was Okudili, then Krishna, and then Mary, and then Clinton. I will say when you ask your question, if you would direct it to a specific provider, if you can.
So my question is, for the person in the center, you said you do evaluations, isn't it?
Yes.
So at what point do you think someone needs the service of needs therapy? So because there's this tendency that people would always say, oh, they're sad, or and then push it to depression in a sense, and then I was reading this book, The Noonday Demon, by Andrew Solomon, and he was talking about how depression is prolonged sadness. So which means a lot of times people just say they're depressed and they're just sad. My own question is, at what point do you say, oh, that this person is actually depressed and needs help?
Yeah, that's going to vary for every individual. I think considering and looking at how is that mood, so the depressed or sad mood, how is that impacting the person's life? Is it getting in the way of their day-to-day activities? Is it getting in the way of them taking a shower, brushing their teeth, going to work, eating? Is it getting in the way of their relationships? Is it isolating themselves? Is it impacting their housing, their financial situation? And I find in my evaluations that people wait too long. We get to a point where it's crisis and, oh my goodness, I need help. It's gotten too bad. So I would actually encourage individuals who are starting to notice some mood changes to come in even earlier than you might think you need.
Wonderful, thank you. Krishna?
Would you consider schizophrenia and psychosis and mania as mental health issues?
As mental health issues?
Yeah, schizophrenia,
yes.
Psychosis. How do you deal with them? I mean, you need a lot of pharmacologic help. So do you have specialized doctors for them? And does counseling help in those cases?
That too depends on the client and how severe their symptoms are, I would say. We have psychiatric providers who can see them for the medication management piece, and some of them are in therapy and getting support and help through that. Others, benefit more through the care coordination outreach services. It's just kind of dependent on their needs and whether that therapy is appropriate for them or not, and that will depend on the severity of the psychosis symptoms. If they're having active hallucinations and delusions, probably not going to be as successful as someone where the medications are helping kind of stabilize that, where they can think abstractly and put what they're learning in therapy into practice.
Is ECT common these days?
Can you repeat that?
Electroconvulsive therapy.
Oh.
Is it common? I mean, I've heard that it helps severely depressed patients.
Mm-hmm.
Is it used?
Yes.
Yes.
I have a couple clients that use it currently.
I think the University of Iowa has.
Mine goes to Falls.
Yeah, Avera and Sioux Falls provides that service. And I think that to piggyback on your question, it's not only just the the doctor and the therapist piece of it, but it's the rest of the supports to help those individuals too. It's, you know, it's whether that's their supported employment coach or the daily supported community living providers, those individuals, and I'll pick on Lake's life skills now, but a lot of individuals, we team on a weekly basis because their needs are changing. So we're meeting together and trying to come up with the solutions or the needs or changing the treatment plan and so forth. So it's always changing.
Mary, you have your question.
So my question's a little selfish. You know, there's this whole area emerging, I will say, of nature-based meditation and ways to nature bathe and get people outside for calming and recentering. And how much of that is being done here? How can we help and participate with that? I think especially for kids, you know, where they're just so overwhelmed. What can be done to bring nature to people and helping alleviate some of these issues?
New concept.
Right.
We don't know what that looks like yet.
We do some of it at Lakeside.
Yeah.
I do it all the time in my groups and stuff.
Yeah.
And say our Mania program is out
Yeah.
and about all the time.
In fact, that was the only treatment a century ago. People used to keep these affected patients in big green parks and beautiful mansions.
Quentin, you had a question.
Yes, mine is more of a general question for anybody that can answer. I know that online therapy or counseling, whatever you want to call it, has gotten very popular in recent years. Is that something that any of your organizations have used, and have people had success with stuff like that?
That was my question. I think COVID helped us with that. I mean, there was a need. When COVID first hit us all, you know, our people needed service.
They still needed to be seen weekly.
They needed to be seen. We couldn't just say, oh, put everything on hold right now. It wasn't working. And we as a region went to our service providers and said, help, how are we going to manage this? And hence telehealth. And you know, both of you guys do telehealth as far as you can explain how it kind of works.
Yeah, I mean, I'm not necessarily in that sector, but I know we've continued it onward. We haven't just said, okay, just because COVID, you know, has been, I don't want to say eradicated because it hasn't, but, you know, kind of on the downward trend, we're just going to stop it. We've continued it. I know a lot of our satellite offices benefit from that, especially because transportation in a lot of our rural counties is very difficult for people. So we've really upped that, definitely, and we use it even in our residential stuff too. So yeah, that's pretty much what we do. What we could add.
Yeah, so I actually started working at Plains during COVID, and so I learned my job over a screen, and that is how I do probably 95% of my work, because I'm often Zooming to different offices to meet with clients, and I also have the flexibility to work from home, so I'm doing that all the time. Our therapists, you know, during COVID did see pretty much everybody over Zoom, and then we've gradually gotten back into the office, so I would say most of them are in office every day and do a majority of in-person sessions, but still do a few via telehealth.
And we're doing groups over telehealth also.
Yep.
Austin, you get to be the last question.
I was just going to say, I know, at least in Ames, in our region, like the need for mental health care far exceeds the resources available. We're trying to get my son an evaluation for ASD and ADHD, and they can't possibly see someone until the end of the year. And so I'm wondering how, in this region, like how do your resources match the need.
I can tell you my child, who's also wanting to, or needing those, diagnostics, would be put on a 2-year waiting list at his current therapy office where he does regular therapy. If that helps with your answer.
So through our open access setup, we can see new clients. ASD and ADHD are, especially in young children, want to take that very seriously and be sure that we are giving an appropriate diagnosis. So if I were to see a child that was maybe showing some symptoms of that, I always tell families, I'm not going to diagnose that today. I want your therapist who's going to be working with you to monitor the symptoms over time. And if they feel that they see the symptoms and meet full criteria for that, they will diagnose it at that point.
I'd like to give another round of applause for our panelists. I also want to be mindful of the time, so it is 8:10, so if anybody needs to head home and put on some slippers, I understand, looking at you, Jace, in the back. But there are probably a few of you who still have good questions. So I would invite you to come to the library next door where we have drinks, waters, adult beverages, as well as snacks, crackers, things like that. We'd love to have you stop by, enjoy some food, and ask our panelists a few questions for what little time they can linger with us before they too want to put on their fuzzy slippers. Thank you all so much, and I hope you have a wonderful evening.